There are two main techniques in hair transplantation. The first is the classic technique, also known as the FUE technique. The second technique is the FUE method, which we can also call the Scarless technique. The classic technique is a long-established method with well-defined standardized procedures. But if our viewers and patients are particularly curious about which of these techniques I consider to be better, I always believe that the FUE technique is a more suitable method. From my perspective, there are two fundamental reasons why the FUE technique is more suitable and superior. Primarily, the success rate is significantly better. Secondly, it aligns with our many years of professional experience. It is a completely scarless technique that is perfectly in line with the field of aesthetic plastic surgery that we have trained in for so many years. Because I am a doctor who hates scars in all aesthetic surgeries, not just hair transplants. Consequently, the technique that is allowed and boasts a high success rate will always be the one I choose to use. I would like to briefly explain the FUE technique and the FUE method to you. In the FUE technique, or the classic method, a strip of scalp is surgically removed from the nape area by cutting it out. We close the area that remains open due to the removed scalp using surgical techniques and sutures. Because there is a potential risk of scarring here, even though I am extremely careful as an aesthetic plastic surgery specialist, a potential risk of scarring remains. So I have barely used this technique for 4 or 5 years. Technique. In the FUE method, we collect hair follicles one by one from the nape using 0.5 to 0.7 millimeter punch biopsy needles. Consequently, it will be impossible to see any scars on the patient's nape approximately 4 to 5 days after this operation. Especially when we consider this in the long run, we can certainly state that it is a scarless technique. As a doctor who has worked in hair transplantation for many years, FUE Gold is a slightly more refined version of the FUE method. Since we apply this method to our patients in our center, we have both increased our transplant success and further reduced our risks related to scarring. We have refined it further. Our patients always have questions for us about scarring. I can clearly state that there will be no scarring with the FUE and FUE Gold methods. But if 15 millimeter punch needles were used, or if 12 millimeter punch biopsy needles are used, there will be scarring issues in any case. Of course, not every FUE is a good FUE. Of course, in the FUE method, 0.5 to 0.7 millimeter punches. Naturally, because we have refined our own FUE method and transitioned to the FUE Gold method, we are the sole center that develops and implements this specific technique. I can state clearly once again that our patients will not experience any issues regarding scarring. Patients always ask, what is the success rate of the FUE Gold method, doctor? I want to get this hair transplant, but people ask how much of the transplanted hair will actually grow. It is important to emphasize that the FUE Gold method has a higher success rate compared to the standard FUE and classic methods. In FUE Gold, this rate exceeds 95%. And in order to increase this rate, if our patient, should there be a need, we can apply supplementary treatments such as stem cell or PRP enhanced hair transplants to achieve a 97% success rate. We even aim to increase it to 98%, and this is what we always say. At Esteport Hair Center, we are growing, improving our systems and refining our results. We will always remain open to development for your sake, and we will continue to improve our success rate. To summarize, the points I would like to highlight in this presentation and this interview are these. There is the classic and FUE method for hair transplants. I recommend the FUE method and our FUE Gold technique to our patients. Our patients didn't know this. With the FUE Gold method, there will be no scarring and our success rate will be over 95%. With PRP or stem cell hair transplants, We can raise this rate to 97 or 98%.